Dear colleagues, I now want to show you a treatment of a chronic shoulder syndrome with interstitial laser technology. This lady is suffering for a long time from a frozen shoulder, and you all know from your experience how difficult it is to treat this pathology. Normally we give steroid injections, we give other therapies like physiotherapy, but very often patients are suffering for years from their problems. We have developed special equipment for this therapy. We give local anesthesia in this area as usual, and we need a small butterfly needle, what we can put directly in the area of pain or in tendon channels or maybe even in the joint directly. And then we connect it with the laser device and a fiber optic catheter. You see in the syringe we have the local anesthesia. Normally we use candicaine, what we give locally in the area. If the pathology is more superficial, so on the shoulder, normally from ventral not more than 2 or 3 centimeters, we can use a smaller cannula, in this case a butterfly with about 2 centimeters long needle, which has a cap at the end, what we can remove later for insertion of the sterile catheter. So in this laser catheter we will give the light from the device of the fiber optic cables by fiber coupling in the plastic fiber and give it directly to the pain or damaged area. For the therapy of the patient we normally use red and infrared laser, and mostly, especially if it's a chronic case, we start with the red laser first for about 15 minutes, and later we treat 15 minutes with the infrared laser. In case of inflammation and redness, or maybe if the area is hot and inflamed, we prefer to give only blue laser because of its anti-inflammatory effects. So I switched now already the red laser on, and we can see it later working. First step now is our local anesthesia, which is a normal procedure in our daily practice. So again, we push the needle forward and pull it back under injection of the local anesthesia. So normally we wait a minute till the anesthesia is working, and now I will insert on the pain area the butterfly needle. This is absolutely pain-free. If you have bone contact with the needle, then remove it maybe 2 or 3 millimeters, that it's comfortable for the patient. So the needle is fixed. I remove the cap at the end and will now insert the sterile end of the laser catheter into the butterfly and fix the needle by screwing at the end. So the end of the catheter is now directly at the end of the needle and is irradiating exactly the pain area. We now connect the fiber optic cable coming from the model of the laser device with the adapter to the fiber optics of the catheter. So the connection is ready, and we can see immediately the transferal of the light to the inflamed area. So the system is working now. And if we switch on off the light, we can see how the light is coming back from our treated area.